Hi, my name is Dr. ILYA Sobol, and I'm a urologist at Urology of Virginia. I did my residency training at the Mayo Clinic in Rochester, Minnesota, followed by a one-year fellowship specifically to learn a procedure named HOLMIUM laser enucleation of the prostate. And I wanted to talk to you about that procedure today and discuss whether it may be appropriate for you so that you could learn a little bit more about the benefits and side effects that could occur. Before I talk about treatment, I want to make sure that we've discussed what the actual problem is. And this is something that you're going to work with your urologist first to make sure that the appropriate diagnosis is made. The diagnosis we're talking about here is something called BPH, and essentially it's a blockage of the bladder being able to empty its urine as a result of growth of the prostate. And this is a benign process. Symptoms can occur for many different reasons: infection, even bladder and prostate cancer. So we're kind of skipping ahead here and we're saying you've already seen a urologist, you've had the appropriate testing done, and we've come to a conclusion that you have this diagnosis. And one of the options for this problem is HOLMIUM laser enucleation. So let's talk about the reasons why somebody would want to have this procedure. Really, you can divide it into two major groups. The first is the medical reasons, and the second group is sort of the reasons that you want it, meaning you want to improve your urination. So the medical reasons are, number one, complete inability to urinate, meaning that you've ended up in an emergency room with a catheter being put in, and now you're in my office and we're discussing how can we get that catheter out and get you urinating again. Number two is recurrent infections. So if you keep getting bladder infections, most often that's as a result of inability to urinate enough out where the bacteria want to reproduce inside of that your remaining urine. And so if we open up the channel, get you urinating better, then likelihood is we're going to decrease the risk of those infections. Number three is bleeding. Now, not all bleeding, it's bleeding specifically from the prostate. So one of those reasons is recurrent bleeding from prostatic origin. And the last is bladder stones. So if you have a stone that's formed in the bladder, it's very different than stones that form elsewhere in the urinary tract, such as kidney stones. These stones typically form because of actually a prostate problem. The urine doesn't get out of the bladder, and for the same reason you form infections, you have this urine that sort of sits around, you form bladder stones. Those are medical reasons. So those are reasons where your urologist may say, look, you're having significant issues. Yes, you can do some medications. Yes, you have these other procedures, but this is the reason that we're doing this. This is the diagnosis, and this is a medical indication. The other reason would be you're dissatisfied with your quality of life and the way that you urinate, meaning that you don't have any of those problems, but you're just unhappy, and we want to try to help you get happy. So what are those symptoms that we're actually talking about here? Well, number one would be the strength of your stream. Number two would be urgency and frequency. Number three would be getting up at night. So let's break those down. So if the issue is the strength of your stream, or how long it takes you empty, or hesitancy, or feeling like you urinate and then have to go back to the bathroom shortly thereafter because you didn't feel like you got it all out, particularly what happens in the morning to a lot of men. Doing this procedure should improve that significantly, and it's pretty instant. We remove a blockage, the strength is stronger. Now, the one caveat to that is that if your bladder doesn't work well, you may not get that stream like you were 18 years old. So that really depends on the functionality of your bladder, and some men have permanent injury to the bladder as a result of long-standing obstruction from the prostate. Majority of men have a significant improvement of the stream, and it's nice to be able to tell folks this is probably going to get better and instantly after surgery. In men whose bladders do not work at all, the nice thing is that over 70% are still able to be catheter-free 5 years after surgery. And that's important because in the past, as urologists, those are folks that got told, sorry, here's a catheter. So now we have an option to help those individuals to avoid catheters. The second symptom that a lot of men are bothered by is frequency and urgency. So the important thing to remember with frequency and urgency is that that's a bladder symptom. Majority of the time, the frequency and urgency is coming from that bladder squeezing really, really hard and working out over the years like a muscle to push urine through this obstructing prostate. So when we treat that obstruction, the bladder doesn't quite get the message. there's a lot of communication that occurs between the brain, the spinal cord, the bladder, the pelvic nerves, the presence and absence of diabetes or other diseases that you may have that influence those things, such that about 80% of patients at 1 year, and that's important to remember, 1 year after the procedure have complete resolution of frequency and urgency. And if you have leakage, meaning that when you can't make it to the bathroom in time, you actually have some loss of urine, that's called urge incontinence, that number drops to about 50%. The good news is, once we're able to treat the prostate and get the channel open, and if you do not have resolution of those symptoms at 1 year, we still have other treatments for overactive bladder that are very effective, from medicines, procedures, such as Botox, or even a sort of a pacemaker that can be implanted to help the bladder. So it's not something that we give up on if that's important to your quality of life. The last symptom that's important to note is getting up at night, called nocturia. And as we can say very confidently that your stream will get stronger, and fairly confidently that frequency and urgency will get better at 1 year after surgery, getting up at night is a very complicated symptom. People getting up at night occurs for a lot of different reasons, whether it's fluid in the legs, or a heart that doesn't pump well, or lungs that don't work correctly, or a sleep disorder. So I usually tell, if a man gets up about 3 times at night, that maybe one of those times is from your prostate. So I would set the expectation that you're going to have some degree of improvement in getting up at night, but I would not expect a cure. And if it's completely cured, we'll celebrate together. But the important thing is sort of the appropriate expectations with that symptom. So let's talk about the actual procedure, HOLMIUM laser enucleation of the prostate, or HoLEP. In order to understand it a little better, it's important to put it in the context of what other procedures there are. Now, I'm not going to go through every single procedure, and there are a lot of prostate procedures out there, but I'm going to put it in terms of something called a TURP, or transurethral resection of the prostate, which has been what's called the gold standard for many, many, many years, over 50 years. So again, if we're looking here, bladder, prostate, and then sphincter muscle here. This is the channel that you pee through in the prostate. The way a TURP works is that we're going through the urethra tube. So this is a natural entry. We're not making any cuts on your body. And we're using some sort of energy source, whether it's a laser, and I think a lot of folks there's some confusion about lasers or this energy or that energy. It's not really important what energy is used. What's important is what the disease is and how much of the disease you're removing, and how are you doing that. So the removal of this obstruction occurs by a resective process, meaning that you shave out the prostate, again, whether you're destroying the tissue with a laser or whether you're cutting it out piece by piece with a bipolar TURP or a monopolar TURP, and you're making that channel larger. So what the channel looks like after that is like this. So you've got still the prostate there, and you have this resected channel. So the channel is now wider, so your strength of your stream becomes better. Now, it may be easy to think about this part of the procedure as kind of like peeling an orange. So in this situation, if you think of your prostate like an orange, there's a rind and there's a pulp. The pulp is the disease. That's called adenoma. That's the part that grows in every man over time. That's the part that obstructs you over time. TURP, you can imagine, just kind of punches a hole through the center of the fruit and makes that channel bigger. So we've got a little bit of the fruit still left, and then you've got the rind. And TURP is a wonderful procedure. In fact, the reoperation rate is somewhere between 7 to actually 30%, depending on what paper you read and which modality has been used. But really, we now know that the important thing is the size of the prostate. So the reality is that there's only so much tissue that can be removed with this procedure. And if you're starting off with a fairly small or medium-sized prostate, TURP would be a wonderful option for you and likely will leave you with a good, long-lasting result. The issue is if you have a little bit of a larger prostate, or if you have a bladder that doesn't work well, then you really need to get the maximal deobstruction that you possibly can. That's where this procedure is not quite as effective as HOLMIUM laser enucleation. Enucleation means removal of the center of something. So how is this procedure performed? Well, in regards to your recovery, it's very similar because the process is a camera that goes in through the tip of the penis and we work on the inside of the prostate. But what's done inside is very different. So when the camera goes in, we actually use a laser, but it's used like a knife, and it cuts or peels the orange from the inside out, all the way at the level of the rind, and you're removing all of the fruit, complete removal of all the obstructing tissue. And then that tissue is pushed into the bladder, and it's then removed. So the way it's removed is with a special device called a morcellator, and that basically goes in again through the tip of the penis. So there's no cuts on your body, and the fruit of the orange is essentially broken down and then sucked out through a special device. So at the end, what you're left with is just the rind of the orange, just this big wide open channel. This is that muscle that controls urination. And this is your channel. And that's the reason that this is so effective for larger prostates and for bladders that don't work very well, because you've created the largest possible channel that you can. And it's going to be a very durable result, meaning that the risk of regrowth or the persistent growth of that fruit part of the prostate with a HoLEP is 1% for a man's life. You can stop all your prostate medications, and likely you'll never have to have a problem with your prostate tissue growing again. There are some other things that occur, such as scar tissue, which I'll talk about. So we've talked about the reasons to have this procedure, what you can expect to improve, and how it's different from other procedures. Now it's important to talk about what your recovery is like and some of the complications that could occur. Surgery does not come without complications. There are always side effects, and there's always a risk to any kind of surgery. So for some folks that have severe medical problems, if we can get by with medicine, that might be the best option. That's that risk-benefit ratio that we work with, and that's an individualized approach to medicine that's taken to find the best option for you. In regards to HOLMIUM laser enucleation, it's a very, very minimally invasive procedure. Nevertheless, there is a risk of bleeding, which is with a risk of transfusion of less than 1%. There is a risk of infection, which is extremely rare but does occur. And if it occurs, it typically happens after the procedure, some weeks later. We always check urine cultures prior to the procedure, so you may have that as part of your visit to make sure that there's no infection prior to the procedure. In the short term, you can expect that you're going to have some blood in the urine, some burning, some frequency, some urgency, but not a lot of pain. The catheter is uncomfortable, and there is a catheter that's utilized at the end of this procedure. And it sits inside of the bladder like this. Drains the urine, and there's a big balloon that sits here in order to help prevent the catheter from falling into that wide open channel. That catheter typically comes out in less than 24 hours. Sometimes in men, if the bladder doesn't work well and they need a little more time, we may keep it in place for as long as 3 days, but that's pretty uncommon. The other risks that can occur in the short term, of course, are related to anesthesia. That's with any surgery, things like heart attacks and strokes, and we make sure that you're safe and your primary doctor sees you to make sure that we can proceed safely with the operation. In terms of leakage, that's a concern for a lot of men. Any kind of urinary procedure, there's a concern. So when you cough, laugh, sneeze, are you going to lose a little bit of urine without your control? That's what we mean by leakage. And the answer is, in the beginning, it's quite common. We remove a lot of tissue from here. There's a little bit of a stretch on the sphincter, and there can be some leakage in the beginning. Now, for a lot of men, it's a couple days or none at all. For some men, it's a couple weeks, and then occasionally we have some men who experience it for up to 3 months until it goes away. The data for long-term leakage is 1% at 1 year. So is there a permanent risk of incontinence? Yes, but that risk is 1% at 1 year. Now, if you already have leakage before the operation, and that leakage is because you can't make it to the bathroom in time, That goes back to the other numbers that we mentioned before, that it's a 50-50 chance by 1 year that that'll go away. But if it doesn't, we can treat that with medicines. That's a different kind of a problem. Remember, that's a bladder issue. The bladder's been working out, and it hasn't adjusted yet to the fact that it doesn't have to squeeze so hard. So in the long term, what other side effects can there be? Number one, scar tissue. That risk is about 1 to 3%, depending on the size of the prostate. So that scar tissue can occur anywhere along that urinary tract. And that's just from doing the procedure. Now, the body doesn't react well, doesn't heal well, and it forms a scar, and that scar will form a blockage. That can be treated in various ways. So there are a lot of successful treatments for the very few men that experience that complications. The other side effect is the sexual side effect, and that is only the effect on ejaculation. So if we break down male sexuality into some components that may be affected, libido, there's no change. In regards to the sensation on the penile skin, there's no change. In regards to the ability to achieve an erection, there's no change. And in regards to orgasm, the neurologic process that occurs, as well as the rhythmic contraction of that muscle, there's no change. What does change and almost always occurs and is permanent is no fluid coming out of the tip of the penis during orgasm. It's important for men to know about that. And if that's not an acceptable side effect, this is not the right procedure for you. There are some other procedures out there, typically designed for a little bit smaller prostates and not the same durability, but they may preserve ejaculation. Such procedures are UroLift and Resume. So now you've learned about the procedure itself and how it can help you to achieve the quality of life that you're looking for from a urinary standpoint. You know about the side effects, either short-term or long-term, and now you can weigh the risks and benefits together to understand if this is right for you. If you have any other questions, this is the part where I'd love to come in and answer specific questions to be able to help you understand whether you'd like to go through with this. But I will tell you that the majority of men that go through with this are very happy, very pleased, and particularly at the 1 year mark are just so thankful that they went through this. A lot of men tell me it feels like they got their life back. So I appreciate you listening, and thank you for your time.